The people, the headlines, the issues impacting you and your family. This week in Cincinnati on 9 on Your Side.
Good morning, everyone. I'm Craig McKee. First on This Week in Cincinnati, a 9 on Your Side I-Team investigation, one that has prompted Mayor John Cranley of Cincinnati to call for an audit into the Center for Closing the Health Gap. Its corner store markets are supposed to provide fresh produce and other nutritious foods in neighborhoods that don't have well-stocked markets. Groceries are so hard to come by in those areas, they are often referred to as food deserts. The Health Gap received nearly $3.8 million from Cincinnati over the past decade, but WCPO found the nonprofit has spent the bulk of its city dollars on employee salaries and benefits, advertising, and even consulting during the past 2 years. Joining us now to talk about this, WCPO reporter Amanda Seitz, part of the team that worked for weeks on this story, and a lot of documents here that you had to review over the several weeks. For people that aren't familiar with this program, so these are mini grocery stores inside convenience stores in these neighborhoods.
Yeah, the whole purpose is really to set up, it's not a full grocery store, but just to be able to provide an option at a local convenience store for someone to pick up a fresh fruit, a banana, a bag of carrots, what have you.
So the nonprofit supplies this grocery store
What
inside?
we found was that the nonprofit, the Center for Closing the Health Gap, which was established really to address minority health disparities throughout Cincinnati and help low-income people work on their health, fitness, that sort of thing. What we found that they do is they supply the signage really for the store. Okay. They also help to train them to, they told us to find like bad, rotten fruit and separate that out from fresh fruit, and then they also give them a one-time $100 cash or check to get started on the program.
Okay. So we're looking at some video here that you shot inside some of the, or someone shot inside some of the stores during this investigation, and we're seeing just some of the fruit stands there, the cooler. So the store itself, the convenience store, this particular stand is inside. That owner of that shop is supposed to supply and keep this stocked?
Yes.
And do they then get funding from the?
No, it was just a 100. We were told it was a one-time $100 bonus, basically, for launching this program.
It's really more of an education campaign than supplying produce to these food deserts.
Yes.
Basically.
Yeah. It's more of a. They told us it's more. They train these store owners as to how to do this.
So why even look into this organization in the first place?
Sure. So what spawned this investigation really was that City Council in January passed a new resolution that asked for some more oversight of nonprofits and the nonprofits that the city was funding, really in particular. And so we kind of sat down, looked at the city budget, looked to see who was getting this funding, right? Like what might have caused some of these city council members to think more oversight was needed in the first place. Right. And the Center for Closing the Health Gap really stood out for a number of reasons. It receives more funding than any other nonprofit in the city by a significant amount. The United Way does get more funding than the Center for Closing the Health Gap, but they actually are the ones that are divvying up additional city money to other nonprofits. So they get the most money as a singular organization. In addition to that, we noticed that the Center for Closing the Health Gap saw significant increases in its funding over a series of years. And when I say significant, I mean like $250,000 from 2016 to 2017. And
just to be clear, obviously, when we talk about I-Team investigations and accountability, we have a pile, really of investigations going on at any given time. We are always looking at ways that the city is funding money, where that money goes, and who is spending it. Sometimes that ends up in a dead end. Money's being spent well. In this case, you discovered a large portion of the money from Cincinnati actually went to benefits and salaries for the people running the organization. Yeah, so we knew from the onset, just because of the way the city's contract works, that most of the $1 million grant that the city is giving to the Health Gap went directly to employee benefits and salaries. To be specific, $737,000 out of the $1 million went to pay for those employees. And then we also got these invoices, this is everything you're seeing here, that shows basically what else they're paying for. And we found that a lot of that is for subcontract work that in some cases was billed in advance. In some cases, there was no description of the work that they did. And then in other cases, it was kind of for vague work. So like a subcontractor would say that they were working on special projects, but with no indication of what that project was. Or
some subcontractors were being paid as much as $20 an hour to watch the front desk for the health gap. And then we also found a lot of invoices for consulting. So there was one consultant in particular that was being paid $175 an hour. The city spent thousands of dollars on this consultant for the health gap to give the executive director coaching sessions, according to the invoices.
So when you take these questions to the nonprofit and you say, all right, what's going on here? Can you explain some of these expenses? How did they
Yeah,
respond?
they really see these as legitimate expenses. They feel like they told us that they don't do programming necessarily, even though that's what city council members told us they would like to see more of their money spent on, the taxpayers' money spent on. But they told us they feel like they're training their employees, having employees is really their version of programming, that they like to train people on how to eat healthy, eat right, and they want to see those people spread out that mission to their neighbors or their family members.
This was obviously the first main part of this investigation. You can read the investigation on WCPO.com. What is next as you continue to follow this?
Sure, I think our question right now is, why didn't the city pick up on, if they're upset about how the money was spent, Mayor Cranley has called for an investigation, why wasn't the city noticing some of these expenses to begin with, and were they looking closely enough at these invoices?
Their own accountability of what's going on with the taxpayers' dollars.
Yes.
Okay. Well, Amanda Seitz from WCPO.com, thank you so much. Of course, we're going to stay on top of the investigation. As I mentioned, you can read all of the details and take a look at some of the documents for yourself on WCPO.com.